In mid-January, a hospital in Everett, Washington announced a patient had tested positive for a deadly new strain of coronavirus, the cause of the yet-to-be-named disease, COVID-19. It was the first reported case in the United States. Concerning, but still a relatively small threat compared to the growing outbreak in China. But fast forward 6 months, and the United States has the most recorded coronavirus cases in the world. So how did it spread in the United States? Looking back, public health experts have pointed to a series of missteps and miscalculations in the U.S. response, a response that has been polarizing and painful, and launched the country into a deadly game of catch-up with a pandemic that has yet to subside. The first major action the United States takes against coronavirus is to restrict travelers coming from China. The first case in Everett, Washington, and a second case in Chicago, both were from travelers who had recently returned from the Chinese province at the heart of the outbreak. But the virus was also circulating in Europe around this time, a second front of infiltration that will go overlooked for several weeks. In early February, U.S. efforts center on how to safely screen and repatriate Americans returning from Asia, like those quarantined on the Diamond Princess cruise liner in Japan. This outbreak is the largest outside of mainland China and shows how rapidly the virus can spread if left unchecked. Public health experts say that a widespread deployment of testing in the U.S. is essential for containment, but test kits sent by the CDC to public health labs across the country prove to be faulty, and the labs are told they shouldn't use them. The FDA bars independent labs from using tests they've developed themselves, and health officials say the public should not wear masks. As the virus silently spreads across the country, experts warn of a testing bottleneck that can't keep up with demand, despite the president's reassurances.
Anybody that wants a test can get a test. That's what
I would just say that we started.
As the CDC expands the criteria for who can be tested, infection hotspots appear across the country. One emerges in New Rochelle, New York. The National Guard is deployed to establish a 1 square mile quarantine zone within the New York City suburb. But by that point, patients and their family members had already traveled to several locations throughout the metro area, including a synagogue and a school. The nation's top infectious disease expert tells Congress the country's testing strategy isn't working.
The system is not really geared to what we need right now, what you are asking for. That is a failing.
In mid-March, the coronavirus outbreak is declared a national emergency, as the country comes to grips with the fact that the lack of testing has made containment more difficult. Shortly after, 6 Bay Area counties enact the first stay-at-home orders in the country, closing all non-essential businesses. The entire state of California soon follows, preceding a cascade of 42 state closures over the next 3 weeks. After initially saying people shouldn't wear masks, the CDC reverses course in early April, recommending they be worn in public, guidance that is highly politicized as Americans become split on the severity of the outbreak. The perils of the virus are on full display at the outbreak's epicenter in New York City. ICUs are overwhelmed as officials try to rapidly increase hospital capacity to treat patients and confront the mounting number of deaths.
I'm tired of walking into rooms and your patient's dead. You just walk into a room and there's a dead body there. I'm tired of calling families and telling them that news.
In less hard-hit areas, Americans protest stay-at-home orders, often without masks, to compel governors to reopen their economies. By the end of May, economic pressures have driven every state to ease lockdowns, despite health experts saying only 3 states meet reopening guidelines set by the Trump administration. These guidelines call for extensive testing and contact tracing, but states have a tough time implementing these measures for a few reasons. First, testing still isn't widely available. One analysis in late May concludes that 53% of U.S. counties don't have a testing site. And this lack of testing disproportionately impacts minority communities. Second, reopening states don't have the resources to trace infections. A recent analysis finds that Florida's Department of Health needs 33,000 contact tracers. The state currently has just over 2,300. Protesters demonstrate against police violence and institutionalized racism as the virus continues to disproportionately affect minority communities. And by the end of June, the epicenter of the outbreak shifts to the south and west, as cases spike in Florida, Texas, Arizona, and California, and forces some states to roll back or slow down reopenings.
We are now having 40,000+ new cases a day. I would not be surprised if we go up to 100,000 a day if this does not turn around, and so I am very concerned.
By mid-July, 13 states see new infections rise by over 20% compared to the previous week, and Florida sets a new single-day record of over 15,000 new cases, as the country debates whether schools should reopen in the fall. The coronavirus outbreak in the United States has proven difficult to manage, and so it's difficult to predict what will happen next. But public health experts say learning from the costly mistakes of the past 6 months may be crucial in plotting a path forward.